Today, we're gonna do part 4 of mastering your health insurance lingo. In this video, we're gonna talk about formulary, a PCP, and inpatient versus outpatient. What is a formulary? A formulary is a drug formulary. It's a list of generic and brand name drugs that are covered by your insurance plan. A lot of drug formularies the way they work is they're divided into tiers. And so the drugs are classified in different tiers. If you have drugs that are on a higher tier, that plan might be a little bit more expensive if it covers those. And whereas some plans will only cover the generics of certain or just a few select brand name drugs, and then there's specialty drugs too that you really want to make sure that if you are prescribed one of these specialty drugs, because they can be very, very, very expensive and you're relying on your health insurance plan to help you cover those, you really want to look at that drug formulary and make sure that medicine that you need is listed on it. So what is a PCP? A PCP stands for a primary care physician. These doctors are basically like your operation control. They're like air traffic control, if you think of it that way. They direct traffic. So what you would do is go to your primary care physician, and with some plans, especially on the marketplace that are HMOs, the health maintenance organizations, they will require you to have a named PCP that you go to first, and that person is then the one that will refer you to specialists. So let's say you have a stomach issue and you need to see a gastroenterologist. If you have an HMO where the PCP is required and referrals are necessary, you would go to your PCP and then have a consult with them. They'd run their own tests, they'd listen to your symptoms, and then they would determine if the referral to the specialist, the gastroenterologist, is actually necessary, and they'd make that referral for you. Now, a lot of people who have PPOs and don't have to have a PCP, they can go directly to specialists. But a PCP is still helpful to have because they are the doctors that can do your annual physicals and just like your general wellness that you would do once a year. And also, they don't have to be doctors to be PCPs. A lot of your PCP role these days is played by nurse practitioners or internal medicine doctors, and also some functional medicine doctors will do this. So what is the difference between inpatient and outpatient? This is an area of confusion for a lot of people. I know that when I started in this industry years ago, it was for me. And so generally, because you really have to read the fine print and different plans have different definitions, you really, really want to read through these. But generally speaking, inpatient means when you are getting a medical service or treatment when you're hospitalized. And so typically what that refers to is more than one night. So if you stay in the hospital more than one night to get a procedure done, you are considered getting that procedure on an inpatient basis. Whereas if you just go into a surgical center, you get your procedure done and you go home the same day, you don't stay overnight. And some might consider it outpatient if you stay one night or just a certain number of hours. You really have to read your documents. But generally speaking, you go have the procedure and same day you're released. That would be considered outpatient. And why is this important? It's important because some plans treat inpatient and outpatient a little bit differently. And so you want to make sure that you you understand how your plan treats a procedure that is done inpatient versus outpatient, and all plans are different. I am here to tell you that health insurance does not have to be so complicating and confusing. If you need help with it, you don't have to do it alone. I would love to help you and your family. You can connect with me at alexthehealthagent.com or follow me on Instagram, where I have so many other fun videos like this one. And if you liked this video or know someone that would, please share it and comment and subscribe.